If you're moving, specifically across state lines, what happens to your Medicare coverage? Hi there, my name is Sarah and I'm here today with iHealthBrokers. Stay tuned. Medicare is a federally funded program designed to provide low-cost health insurance for senior citizens. If you've enrolled in anything other than original Medicare, you've probably noticed that they ask for your location on Medicare.gov when you're looking for supplementary secondary insurance. So, what happens when you move? Well, we're going to discuss that in today's video. Now, if this is your first time to our channel, welcome. At iHealthBrokers, we are licensed nationwide and with over 200 carriers. So if you have any questions whatsoever, please feel free to just leave them in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. There is absolutely no charge for our services. And as always, please make sure to like this video. Liking this video will make it more visible to others who are looking for the same type of information. And of course, subscribe to stay up to date on all things Medicare and health insurance in general. And if there are any videos you'd like to see, you can let us know in the comments below as well. Original Medicare is comprised of Medicare Part A, which is your hospital insurance, and Medicare Part B, which is your outpatient insurance. Together, they're going to cover most of your health care needs. Now, if you move, even across state lines, there's actually going to be no change in your original Medicare. Remember, Medicare has a very wide network of doctors and hospitals who accept Medicare, so you should have absolutely no issue finding a doctor in your new area, and you should have no issue finding a hospital that you like that accepts Medicare. Also, your monthly premium for Medicare Part B is based on your income, not on your geographical location, so there's going to be no change in your monthly premium, and most people don't have to pay for Medicare Part A monthly premium. One thing I do want to mention, if you are going to move, you might want to contact Social Security just to make sure that they have your updated address. You don't want to miss out on any Medicare-related mail. And if you pay your Medicare Part B monthly premium from a specific bank and you're going to be changing banks, you'll need to update that information as well. You may have also enrolled in some type of supplementary coverage. If you're enrolled in a Medicare supplement plan, also known as a Medigap plan, there's also going to be no change. Medigap plans are entirely portable, and they work on the same network of doctors as original Medicare. This is something we talk about in our other videos, so do make sure to check those out in the description below. Remember that if you enroll in a Medicare supplement plan, regardless of who your carrier is, if they accept Medicare, then your doctor accepts your Medicare supplement plan. It doesn't really matter who your carrier is. Just something to keep in mind. So when you move, you should have no issue finding a new doctor and a hospital that's your preference. Actually, some Medigap plans even offer some type of foreign travel exchange. And again, you may want to update your information with your new address, but really that's no different than any time that you move. Now, as for pricing, so Medicare supplement plans are dependent upon your geographical location. So if you move, your carrier may choose to re-rate you. Generally speaking, it's not going to be a tremendous difference, but it is something that you should be aware of. You may be charged a slightly different rate than what you were paying before. But should this happen, you always have the option to switch plans or choose a different carrier. Additionally, remember, Medicare supplement plans work slightly differently in Minnesota, Wisconsin, and Massachusetts. So if you're moving to or from any of these states, then you may need to reevaluate and enroll in a different plan. Then there are Medicare Advantage plans, also known as Medicare Part C. Now, Medicare Advantage plans actually replace your original Medicare entirely, and generally speaking, they'll offer different benefits than Medigap plans. Now, one of the major drawbacks of Medicare Advantage plans is that you don't have access to that same extremely broad original Medicare network. You're going to be beholden to your carrier-specific network, whether you choose an HMO or a PPO. You're still going to want to operate within network unless, of course, you have a PPO and you need to see an out-of-network doctor, but as you know, that's usually going to be more expensive. Now, with Part C plans, you can find plans with nationwide PPO coverage. However, usually your plans are still going to be more or less tied to your geographical area, or rather the geographical area from when you signed up. Because of this, you're definitely going to want to find a new Medicare Advantage plan specifically tied to your new home address. Actually, that's sort of one of the complaints that we hear most often, is that it can be a little bit difficult to find a doctor that accepts a specific Medicare Advantage plan. And sometimes people find themselves having to travel a significant distance. So if you're moving, it's especially important that you find a new plan that will work with your new address. Now, actually, this may work in your favor. You can use this opportunity to drop your Medicare Advantage plan and find one that better suits your needs. You'll have a period of 30 days before the move and 30 days after to drop your plan and find a new one. Remember that in some areas of the country, Medicare Advantage is highly favored, and in some areas of the country, Medicare supplement plans are highly favored. So if you're moving to a new area, you may find that Medicare Advantage no longer suits your needs. At that point, you can drop your Medicare Advantage plan and join a Medicare supplement plan. You may have prescription drug coverage that's wrapped up in your Medicare Advantage plan, or you may have a separate Part D plan if you still have original Medicare. Either way, if you move across state lines, you're going to want to enroll in a new prescription drug plan. The rules for Part D are the same as the rules for Part C, so make sure you enroll on time because you don't want to miss your window and be without prescription drug coverage if you need it, and you certainly don't want to be subject to a late penalty. If you want to check out the plans available in your current area or in your new area, simply head over to Medicare.gov, that's Medicare.gov, and access the Plan Finder. Or, of course, you can always work with a broker. So if you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. We're licensed nationwide, so no matter where you're moving, we can help. And there is no charge for our services. And isn't that a relief? Because moving is expensive. If you liked today's video, please make sure to click like. Clicking like will help us to get this information out there in front of others who may need it. And of course, subscribe to stay up to date because we do release these videos on a weekly basis about Medicare Advantage, Medicare supplement plans, and whatever videos you'd like to see. So if there's a video you'd like to see, let us know in the comments below, or feel free to ask any questions and we will do our best to help. So have you moved with Medicare? What has the transition been like? Let us know. If not, we'll see you next time. Bye-bye.